Doctor, is it true that there are several forms of dermatitis? Yes, that is true. What are some of those forms? Well, there is a bullous eruption which develops, but it is distinguished from true bullous diseases by a short duration and good prognosis. Doctor, I see in your medical record the term pemphigus. Yes. What is that derived from? Well, if you want the word derivation, it is derived from the Greek pemphix. And what does that mean in Greek? It means blister. And that blister points up what? It points up the chief characteristic of pemphigus vulgaris, namely the formation of blisters. Doctor, what causes these blebs to arise suddenly? Well, they are apparently normal or slightly erythematous skin formations and form oval-shaped or round blisters containing clear serum. Doctor, the blisters tend to be flaccid, do they? Yes, they tend to be flaccid and to break easily. Doctor, does the epidermis become detached? Yes, it does. And what does it leave? Leaving increasingly larger areas of denudation. Doctor, have you ever heard of the Nikolsky sign? Yes. In these conditions, that sign is always positive. How is it obtained? It is obtained by pressing on the skin with the fingertip. The epidermis then slides off and a raw surface remains. Doctor, what about the denuded area? Well, the several denuded areas are slow in healing and constitute a continuous threat of infection. Doctor, has pemphigus been compared with a serious burn? Yes, it has, but in reality, the trauma of a burn is a single occasion, and the lesion is frequently localized. On the other hand, doctor, can the injury be inflicted upon the skin by numerous crops of bully? Yes, bully followed by widespread denudation presents a still graver problem than that of many a burn. And the blisters vary, do they, doctor? Yes, they do. They vary in size from a few millimeters in diameter to 10 centimeters. Doctor, when they develop, what happens to the old ones? When new lesions develop, the old ones disappear. Since the crops arise rapidly, often overnight, and old lesions heal slowly, the area of denudation is extensive. Doctor, let me ask you this. Eventually, what happens? Eventually, crusts form over the raw surface. If pyogenic bacteria get beneath these crusts, foul-smelling pus collects and increases the patient's physical distress. Is there any scarring, doctor? Yes, or rather no. There is no scarring, only a hyperpigmented lesion remains. And that is the formation of bully in the oral cavity? Yes, which is incidentally particularly painful. Blebs about 5 millimeters in diameter are scattered over the buccal mucosa. And doctor, do they appear Spontaneously? Yes, they do. And they rupture and leave raw ulcers, which inflict much pain. Doctor, blebs may occur in other conditions. Yes, blebs may also occur on other orificial mucous membranes. What is the etiology of pemphigus, doctor? The etiology of pemphigus is still unknown. Some authorities believe that it is metabolic in nature or caused by bacterial or viral infections. However, no theory has yielded convincing evidence to that effect. Doctor, what are the common types of pemphigus? Well, the commonest type of pemphigus is a chronic, recurrent disease afflicting only adults. Are there exacerbations, doctor? Yes, there may be acute exacerbations which may be followed by brief or prolonged periods of remission. As a rule, pemphigus vulgaris lasts from several months to years. Untreated, it is a fatal disease, but with the judicious use of cortisone, the prognosis is favorable. I might say people suffering from pemphigus are the delight of dermatologists since they are, for the most part, lifetime patients.